Hi friends, good morning. This is the continuation of our integumentary system burns topic. Today we will study the type of burn injury based on the depth. In the first video of burn topic, we have told that the severity of the burns depend on some of the factors like how long that particular client exposed to that burn situation or scene, and the depth of the burn and the type of the burn. So those things. So here we will study based on the depth how to categorize, or based on the skin layers. In the depth we know that it categorization based on how many layers of the skin is affected. So we will study mainly we have three types, which means first degree, second degree, third degree burns. But in some of the text, or especially in English or an exam, sometimes they will specifically mention that superficial partial thickness burn, or deep partial thickness burn, or deep full thickness, like this. So in the picture, in the video, I just make a table to clarify, to make it more clear what is first degree and what is second degree and what is third degree. Here the first one, the first degree is equal or is same like a superficial thickness, and the second degree we have another classification, that is superficial partial thickness and a deep partial thickness. See, just remember that two partial thickness type of burns based on the depth. That is, one is superficial partial thickness and the another one is deep partial thickness. This two partial thickness will come as second degree burns. Keep it in our mind. Second degree burn is equal to superficial partial thickness and a deep partial thickness. Okay, then the third degree burn is equal to full thickness burn. Okay, that is the three types classification. We'll see one by one. What is the first degree or superficial thickness burn? How does it appear? Usually this appear like pink to red, and there is an erythema, there is a mild edema, then there is no blister, no scar or no scarring, then a little bit tender. Here in the picture you can see, for example, sunburn. And this is the another one, capillary refill. Capillary refill usually fast, and the sensation or the pain, it is painful. Okay, the superficial thickness or the first degree burn is usually painful, and the capillary refill is usually fast, and example is sunburn. And this will affect only the epidermis layer. That is very important. Even in the pressure ulcer also we studied that the first stage is equal to epidermis, only the affected the first layer of the skin. That's why here we told there is no blister. If blister, it will go to dermis also, second layer. So the first degree or superficial thickness burn, it will appear pink to red, and there is no blister, no scar, no scarring. But there is mild swelling or edema, and the patient usually feel painful, and the capillary refill is fast. Example, sunburn, usually it take 7 to 10 days or 7 to 14 days to healing. Okay, now the first degree or superficial thickness burn is clear. Okay, with the picture, just keep it in the mind. That's it. Now we will move to second degree burn or superficial partial thickness and deep partial thickness. Okay, how does it appear? Usually the second degree burn, it will appear like the first superficial partial thickness, it will be like red to white. Okay, otherwise it will be more reddish, and sometimes if it is it will, in this one will affect the superficial partial thickness. The word, just keep it, superficial partial thickness. It will affect epidermis and some part of the dermis, not the entire dermis, some part of the dermis, that is superficial. Okay, and there will be blister, but no scar. There will be blister, and patient usually have pain, and pain is little bit more compared to the first degree, then it will take around 2 to 4 weeks or 2 to 3 weeks to 3 weeks for healing. So in the second degree, the first one is superficial partial thickness. That one, the wound will be appear like red to white or more reddish, and there will be blister, there will be mild to moderate edema. That is also important. Mild to moderate edema, no scar, pain will be more, and example is like flames or scalp burns. These are the examples, and it may take around 2 to 3 weeks or 2 to 4 weeks for healing. So that's it, finished. See the picture also. Then the another one category in the second degree, that is deep partial thickness. Okay, keep it in mind, deep partial thickness. When you listen the word deep partial thickness, before we told superficial partial thickness only epidermis and some part of the dermis, but in deep partial thickness, epidermis and the deep part of the dermis, which means almost the entire dermis also. So the two layers completely affected in deep partial thickness of this second degree burn. In this one, the wound would be like red to white, will be more white, and there will be less wet. Sometimes there is blister, sometimes there is no blister, with or without blister. Then the capillary refill absent or sluggish. Pains, there are certain cases client have pain or pain during touch, sensation to touch, and sometimes there is no pain. Then how long it will take? Usually it will take around 3 to 6 weeks or 3 to 8 weeks, and if it is severe, it required a grafting for complete healing. That is one added or special point in deep partial thickness of second degree burns. Okay, here we told it is a red to white, plus or minus blisters, maybe blister or without blister. Then the capillary refill usually sluggish or absent. Then pain, sometimes there is pain or sense touch, during the time of touch they have pain, and if no, there will be likely there is scarring and a scar. So if more scarring, severe scarring, we need the patient should undergo for grafting for complete healing. In this, the swelling will be moderate. The first one we told mild, then the partial thickness, superficial partial thickness we told mild to moderate, but in deep partial thickness, moderate swelling. Okay, these just some of these changes should just keep it in the mind. That's why I haven't added many details in this table, just only the details and with some symbols, so you will keep it in mind easily. Then now we are moving to third degree. Third degree burns is equal to full thickness burn. In that one, this will affect epidermis, dermis and subcutaneous, same like pressure sore. The third stage, epidermis, dermis, subcutaneous. So how does it could be? It would be look like white to black or brown. Usually will be dry, and usually there will not be pain, and the capillary refill also absent. Then it requires grafting in most of the cases for complete healing. So the main point we should keep in our mind, in each degree burns, what all are the layers of skin affected and how long it will take for the healing, and how does the wound look like. In the third degree, the wound look like white to brown or black. Sometimes in other books they can say that deep full thickness. That one is going to affect the entire subcutaneous and sometimes the muscles. And also in this third degree, it will affect the nerves also. And usually it will take months for complete healing. It's based on the type of graft what we are using. So this is all about type of burn injury based on the depth. Okay, first degree, second degree, third degree. Is that clear? I hope it's clear for you. You can see one more picture. just added based on the layers because it's very important. Most of the question scenarios are coming based on the layers of skin and its appearance. And other synthesize or analysis questions will come in this particular stage or type of wound. What is the intervention or the management, or which type of grafting is more suitable for better healing? Okay, is clear? We'll discuss one question. After the initial phase of the burn injury, the client's plan of care will focus primarily on what? Here the keyword in this question is focus primarily, which means the initial or the first action after the initial phase of the burn injury. That is also a keyword. See, here they finish the initial phase of the burn injury finish. Then the next stage or in the next phase, what is the primary action? Option 1 says helping the client maintain a positive self-concept. Option 2, promote hygiene. Option 3, preventing infection. And the last option is educating the client regarding care of the skin grafts. What do you think? Which one could be a better option? And the scenario. Helping the client to maintain a positive self-concept. Is that the main thing that we should concentrate as a primary or initial step in the scenario? No, we can remove that. Promote hygiene. Yes, we require that one. All these steps is necessary. These are the interventions, but we should check the primarily or the initial intervention. That is, what is preventing infection? Yes, that is our answer. Why? Because usually the infection or the inflammation will start once the burn is sustained. Because once the patient exposed to burns, a patient exposed to burns, the total body system get impaired, and we know that skin is the layer that is protecting our body from all other surrounding infections, so that is also get burned. So that is going to increase the chance of getting infection, and all the phagocytosis and all the process of the protection or the immunity against infection is get impaired. So the chances of getting infection is the main problem in this stage after the initial phase of burn injury. So we should focus all the interventions to prevent the infection. So that is our primary focus in this phase or the phase after the initial phase of burn injury. We will see the other option also, educating the client regarding the care of skin grafts. This skin grafting and coming on after this stage, after this phase, and the promoting hygiene, positive self-concept, these are all part of the rehabilitative phase of the burns. Okay, is that clear? We'll see one more question. This is a SATA question, which means select all that apply question. This is one of the common type of question that usually students have problem in NCLEX or an exam. Okay, just concentrate. There has been a fire in an apartment building. All residents have been evacuated, but many are burned. Which client should be transported to a burn center for treatment? Select all that apply. See here they have given 5 options. In each options, the clients with a particular percentage of total body surface area burns and all those things. So out of these 5 options, which all are the clients or which client? It might be only one client or all 5 clients or 2 or 3 clients who should be transported to burn center for treatment, for further treatment. This is when a treatment. We'll see. An 8-year-old with 3rd-degree burns over 10% of his body surface area. Now, already we studied what are the 3rd degree, 2nd degree, 1st degree. Okay, just keep those points in the mind. Then, second option, a 20-year-old who inhaled the smoke of the fire. Third one, a 50-year-old diabetic with 1st and 2nd degree burns on his left forearm, about 5% of the total body surface area. A 30-year-old with 2nd degree burns on the back of his left leg. A 40-year-old with second degree burns on his right arm, about 10% of his total body surface area. See, before going to answer this question, I wanted to include one more point to answer this question. When we are selecting the patients for further treatment or better options, treatment options and assessment in the hospital settings or burn center, we should keep some points. In that one point is the client below 10 years old and more than 15 years old with second or third degree burns, which is 10 or more than 10%, should be transported to burn center or hospital for further assessment. Okay, the client should be below 10 years and more than 15 years, and it should be third degree or second degree burn, and the percentage it is equal or more than 10% of total body surface area. This is one point. And the another point is that the client who is between this particular age, because we told 10 and 15, so between 11 and 49 years of age with second degree burns below 10%, or not below 10%, below 20%, no need to transfer to burn center. See the age between 11 and 49, and if the burn total body surface area of the burn or second degree or third degree more than 20%, they should be transferred to burn center. If below 20%, it is not the primary focus, but we should consider some other points also. Okay, this is some of the common points to take the answer. Then another point, the client who is non-case of diabetic or who have some cardiac or kidney problems or who have some other arterial problems, at any age, they might be below 10 or they might be more than 60, they might be 35 years, whatever it is. If they have or they are diagnosed with any of these problems or they are not case of any of these medical conditions with the second or third degree burns and the body surface area equal to 5 or more than 5% is also should transport to burn center for further interventions and treatment. So here we discussed the main 3 points. So keep these points in the mind. Is that clear? Now we will see the options. Based on these 3 points or based on the points that we have studied in the type of burns or the superficial first degree, third degree or second degree burns, what all are the options you can easily eliminate? We can eliminate the option number 5. A 40-year-old with a second degree burns on his right arm, about 10% of his total body surface area. See, he is between the age of 11 and 49, and this is second degree burns, and the percentage is below 20%. So we can eliminate that. We told more than 20%. Eliminate. Then a 30-year-old with the second degree burns on the back of his left leg. Here they didn't mention the percentage, even though the client is not a known case of any of the conditions that we have discussed, and the client age is also between the 11 and 49, that is 30 years old, and this is only second degree burns and just left behind the back of the left leg. So as per this scenario, this is not a that much severity case, so we'll just eliminate that one also. Other option. The option number 3, a 50-year-old diabetic with the first and second degree burn on his left arm, about 5% of his total body surface area. What do you think? Yes, this is our answer, because he is a non-case of diabetic, and this is first and second degree burns, and this is more than or equal to 5% of total body surface. Always think this diabetes clients, once they develop burns or they are exposed to burn injury, the chances of further complications are very severe. So we should all definitely transfer to Burn Center Hospital for further treatments, interventions, everything. Okay, so this is our answer. Then another one, a 20-year-old who inhaled the smoke of the fire. See, here they didn't mention whether it is a non-case of any conditions and how long the percentage. The option is not that much clear. Only the smoke of the fire. The smoke of the fire, sometimes it will be severe, but we didn't get a percentage, or we don't know the severity. We will just keep it for consideration. We are taking the priority ones as the client should transfer to Burn Center. Then an 80-year-old with a third-degree burns over 10% of his body surface area. So here we have statement going. The client below 10 years old, he is only 80 years old, so 1 point that is okay. Then third degree one, other point is also okay. Then is over 10% of body surface area. So that is also the point that we discussed. So he also should transport to Burn Center. So what all are our answers? Our answers are option number A and C. That are the main priority clients should be immediately transferred to Burn Center for the treatment. Then other clients, based on their situation, maybe they are developing some other symptoms. Some might be get anxiety, some might be get some kind of severe feeling of fear or something. So based on that, we will again we will do further assessment and we will transfer. But the main priority cases here, A and C, the option 80-year-old and 80-year-old. Is that clear? So this much for based on this first and second degree, third degree. We'll discuss some more questions and topics on the coming videos. Bye bye.